Madam Deputy Speaker. The crisis in the NHS dentistry is plain to see and is affecting so many of my constituents of Sheffield, Brightside and Hillsborough. I am therefore grateful for this opportunity to shed light on the emergency and support Labour's plan to rebuild our broken dentistry. People are finding it impossible to find an NHS dentist for themselves and their children, leading to serious consequences to public health. This is also exacerbating health inequalities and creates a divide between those who can afford private dentistry and those who cannot. The proportion of children with dental decay in the most deprived areas is over 2.5 times greater than in the least deprived areas, and the gap is widening. This has led to a public health crisis. 169 children each day are undergoing tooth extraction, and rotting teeth is the #1 cause of hospital admissions, shockingly among 6 to 10-year-olds. 1 in 10 people have even attempted their own DIY dentistry. We know this doesn't work, it just does damage and puts even more pressure on the NHS. This reads like a Charles Dickens novel, but it is the harsh reality of 14 years of Conservative government. Nowhere is this more apparent than in my constituency. Of the 7 dental surgeries which recently provided an update, not a single one was accepting a new adult patients. Only 1 was accepting new child patients. Whilst these figures are appalling, they are not surprising. I am regularly contacted by my constituents who are not able to find an NHS dentist and cannot afford to go privately. They ask me, what am I supposed to do? And without radical reform, there is no answer I can give them. We often talk about crumbling dental services, but in my constituency, they have already crumbled. The services simply are not there for the people who need them the most. One of my constituents has contacted over 25 dentists in Sheffield, and each one has told her the same thing. They are not accepting new NHS patients at this time. The best she has been offered is to be put on a waiting list, which could last years. She cannot afford to go private, so she and her young child are stuck without any access to a dentist at all. We've also seen the provision of community dental services grind to a halt. These services are a vital safety net, providing specialised treatment when other dentists can't accommodate the needs of disabled people and people with long-term health conditions. But this safety net is no longer there for all too many people. Research shows that over 12,000 children nationally are on waiting lists for community dental services at the start of 2023 and could face waits of up to 80 weeks for tooth extractions. Healthwatch has heard from many people and their carers who cannot access community dentistry, leaving them without treatment. Madam Deputy Speaker, the basic provision of NHS dentistry has been worn away under this government's watch. The warning signs of this crisis have been stark for years, but ministers have continued to bury their heads in the sands. Funding has been cut in real terms, meaning dentists are leaving the NHS in droves, and areas like mine have become dental deserts. It is clear that this government is not willing to provide the radical changes needed to bring NHS dentistry back from the brink. In April last year, ministers promised a new dental recovery plan, but we are still waiting for this to see the light of day. And I would really urge the minister to actually tell us when that is to be, not just say soon. Labour has formulated a fully costed plan which will get NHS dentistry back up and running. The best treatment is prevention, and that is why Labour will introduce a targeted supervised toothbrushing scheme for 3 to 5-year-olds, encouraging lifelong good dental hygiene. Labour will also provide an extra 700,000 urgent appointments per year to help the most vulnerable access the services they need, and introduce an incentive scheme to bring more dentists to dental deserts. All of this, I'm proud to say, will be paid by abolishing the non-dom tax status. These tangible steps will bring NHS dentistry back to constituencies like mine, where services have disappeared. Where this government has failed, Labour will step in and help all our constituents access the NHS dentistry they need. I will be proud to support Labour's plan in today's vote and urge all colleagues, including the other side, to vote with us. Yeah.